Well, Medicare for all, that certainly is one of the solutions which I have become more and more, um, I would say more and more in favor of. I do like the idea of competition. In other words, I like the English system, where although you have a national healthcare system, you still have an option for private healthcare, and those two systems then compete. One of the worst systems, in my opinion, is really the Canadian system, because there you not only have no competition, it's all government run, but the Canadian system runs like Medicaid, where every province actually has a separate system. And so when you try to figure out what's going on, you can pull the bad aspects of one province, talk about it, or the good aspects of another one and talk about it, but yet it doesn't reflect what's going over or what's going on in the whole healthcare system. And so I think that the English system, where you have a uniform national system, which would be National Healthcare Service, similar to our VA system, but you also have a private option. And I'm not talking about a government funded private option, but a private option where you have benchmarks of what you should be performing at in your government system. And I think that gives you probably an optimal type of a system to have. So I guess that's kind of a hybrid. And I think that that would be a good solution. Certainly short term, I think that Medicare for all is an important step, but you realize that Medicare or Medicare for all, the devil is in the details.